Hello everyone, my name is Loyce and I'm one of the young people living with HIV in Zimbabwe. And I'm 21 years of age. Both my parents passed away along with my younger brother. And I joined the African Journey program in 2004 when it started. And personally, as Loyce, I developed the desire and passion to disclose my status publicly because of the challenges that I went through the moment that I got to know about my status. I went through stigma from some of my family members. I faced emotional and verbal abuse from some of my family members, and also seeing what my other peers who are living with HIV, the challenges that they were facing on their daily lives. It actually drove my eagerness and passion and that desire to disclose my status publicly, just with the aim of changing the world on how they view us as HIV positive children and adolescents living with HIV, as well, just to make the world a world where we are listened to, a world where we are also supported, and a world where we are just normal. In 2009, I became one of the CATS, and CAT stands for Community Adolescent Treatment Supporters. These are a group of young people who were out of school, got nothing to do, and they were mentored, trained, and went through clinical attachment so they'll be able to know how best they can support their other peers living with HIV. My role as a CAT is to support my other peers adhere well to their antiretroviral therapy, which is the key that we do as CATs. And by doing so, we also do home visits to them. We also follow up on defaulters, those children who would have defaulted on their antiretroviral therapy. We also offer counseling to the caregivers, where we also counsel them on how best they can support their adolescents and children whom they are living with at the household level. And we also work in partnership with the clinics and hospitals, where we also help the clinics in counseling the children so that it will be easier for them, and it also makes an impact to the children and adolescents when they come to the clinic, when we also share our own personal experiences to the children. And one of the important roles that we do as the community adolescent treatment supporters is facilitating the Zandri centers, which are sited at clinic and hospital setups. We offer counseling on issues to do with relationships, disclosure, issues to do with family planning, issues around STI, as well talking about issues around sex. And the Zandri centers, these are more of like the youth-friendly centers, but as African and as us adolescents, we said we wanted them to be called the Zandri centers. As part of my work, we also train the doctors and the nurses, the counselors, the service providers on issues around adolescent care, as well on how adolescents need to be supported within the different areas that they happen to live in their daily lives. Some of the interventions that we have come up with as adolescents within the African Journey program, we came up with the pill box, which helps to monitor adherence of the children and adolescents. We also came up with our storybook, which as the HIV positive adolescents wrote. It talks about how we felt before and after we were tested. And we have also developed the soldier game, which simplifies and breaks down the bigger words that explains more of what HIV is and how it affects the body. So this soldier game, it helps the adolescents and the children understand more on adherence issues to their antiretroviral therapy so that they become confident about who they are. I'm very happy to say, as one of the adolescents living with HIV in Zimbabwe and being part of the CATS project has been able to be scaled up to 4 other provinces within Zimbabwe, and all these services that I have mentioned are being accessed by the children and adolescents within the 4 provinces that we have scaled up. Having said that, there's also a challenge on the issues of service providing to the area of children and adolescents living with disability, as most of the clinics and hospitals, they are not equipped on how best to offer these services, and explaining more what is HIV, how they deal with HIV to the children and adolescents who've got hearing impairment, visual impairment. And as Africa's Genre program, us as the cats, we have been trained on basic sign languages, and we've got also cats member who've got a disability who also do home visits to her other peers who are also HIV positive with disability, so that they'll be able to understand more of who they are, and as well knowing how best they can live positively living with HIV. And my key message to you all will be, let's come together and help children and adolescents living with HIV adhere well to their medication, because adherence is very important to keep us healthy, confident, and smiling every day. And never judge a child when they say they are not being able to adhere well, because adherence is very difficult. I have gone through that experiences. And if you're an adolescent listening or seeing me, I say you are not alone in this. We are together.